Hello, I am Professor Petrov from Medical University Varna, Bulgaria. I'm head of clinical vascular surgery. The topic today that we are going to discuss is a combination of topical and oral treatment of chronic venous disease of lower extremities. This is my document for disclosure form, and we can speak about the problem, of course, today. The first question that we have some 15 years ago was, how much do we know about pure diosmin 600 milligrams? Of course, we have different ideas of different medicines that we use. But in the beginning that we heard the word phlebotomy, it was curiosity. And is it something totally new and effective one, or just a new medicine that will erase after, like many others? The answer came very soon. The answer came very soon. This was a hit, a very balanced and practical for intake, with excellent effectiveness and very good tolerability. Patients like it very much. The cost and effectiveness seem to be calculated perfectly. In the market, there are a lot of competitive issues, but common sense and practice rejected most of them. The success of phlebotomy in Bulgaria is based on the fact that both doctors and patients are happy to use it in everyday practice. The way of introduction to Bulgarian market was very important, very precise and balanced, with no exaggeration and superiority presentation. Once it came to pharmacies, it became a popular item. I think that the name of every medicine is something like the name of a man. As you know, they say the character of a person is 10% dependent on the name. People here like the name of the product, and it sounds very good and is remembered easily. Patients also are eager to find new medicines, and they always search for another option. I have a female patient who keeps visiting different pharmacies, and everywhere her question is, do you have something new? It sounds funny, but it's true. The phlebotonics themselves are a very special item because they are not life-saving medicines, and people are quite prone to make changes and experiments with different products, especially advertised by TV or relatives. The interesting fact about phlebotomy is that very little patients discard it for anything else. Once a patient has started taking it, it is a love forever. Like men love their favorite football team and women their children, probably perfume. Pure diosmin phlebotomy is a very special medicine for chronic venous disease. It should be taken 1 tablet daily, and this shows 3 main benefits. First is relief of symptoms of chronic venous insufficiency. That is pain reduction, improvement and disappearance of heaviness in the legs in 3/4 of the patients. And so edema, 7 of 10 patients. And relieve patients in their daily activity, which is proved by 7 from 10 patients. Comfort of use shows simple posology due to the optimal dose of diosmin, and only 1 tablet a day is very important issue. Easy intake and very high compliance, that is 96%, so tolerance of 99%, that is 100 according to me. The quality of the medicine has international presence, 40 years on the global market, 100% made in France, which is also very important, as you know, in Western world. One active ingredient is pure diosmin without hesperide. The clinical implementation of this medicine is very special. You know that in our clinical practice, patients trust the specialist. This is for any reason and illness, and it is based on the fact that specialists have more experience and scientific knowledge about the right and contemporary visions in the field of science and practice. In my clinic, we use pure diosmin 600 milligrams as a routine medicament in every venous disorder. I will recommend it for long-term therapy afterwards. When patients come for follow-up, they give us impressions about the effect, tolerability, price, side effects, etc. And as I said before, the balance of all these seems to be very good, and patients are satisfied. The comments and assessments of GPs are the same, and this also reflects in good marketing of the medicine. In order to make objective criteria for assessment of phlebodia, we use some methods. First, subjective impressions of the patient according to the main venous symptoms, swelling, pain, restless legs, etc. Every patient treated by us reports for relief of this in different degrees, from full recovery to slight improvement. Second, the swelling can be measured before and after treatment, and it proves to reduce the maximal circumference of the cuff and paramalleolar region with more than 2 centimeters after 1 month treatment. The Doppler findings also show slight improvement in the percentage of recanalization after deep vein thrombosis. A new stage in the development of venous treatment began when the systemic and local treatment were combined. This came to practice with 2% diosmin cream gel, local ointment, the first one with diosmin. It helps to relieve the feeling of heaviness and fatigue in the legs. Menthol provides cooling sensation and helps to reduce discomfort in the legs. It has quick absorption and does not stick or leave any stain. The anti-inflammatory and antioxidant effects of the 2% diosmin cream gel show significant and anti-inflammatory properties. They decrease the number of dilated blood capillaries and mean area of dilated blood capillaries. They have an excretion of IL-8. They have significant antioxidant properties, and they decrease the number of cyclobutane pyrimidine dimers plus cells. And they have hydroperoxide level. The combination of local and system treatment show some facts. Although very fresh, the combination proved to be effective in several groups of patients. Of course, the most of our patients have post-thrombotic syndrome. That means that the maximal circumference of the leg and paramalleolar region is reduced with more than 2 or 3 centimeters, which is better than using tablets alone. Superficial varicose thrombophlebitis, I think this is a very good indication for the combination of pure diosmin, peros, and cream gel. Patients report very quick and significant relief of clinical symptoms, that is redness, tenderness, pain, and swelling of the leg. And this is especially important in patients who underwent crossectomy. Also, very good relief appears in patients with not complicated varicose veins in stages 2 or 4 by SEA classification. Patients report better quality life and reduction of pain, swelling, and tension in venous structures of the legs. And as a whole, the combination of local and systemic treatment is reported to be more effective than the single use of these two. In my opinion, in the future, we shall have more information, more trials, and more indicators for it. And these are the references with which I thank you very much for your attention.